come out of the operating theatre and the husband is standing in. He's got a bundle in his arms tied in a towel. It's clearly the body of the dead baby. Operate on a woman and remove a dead child. That's something very disturbing.
The Kori chiefdom in the southern province of Sierra Leone is a lush, fertile area of tropical West Africa. The people here live without electricity or running water, and do the difficult work of farming by manual labor, which supplies a harvest of fruits, grains, and cassava to the urban population of Sierra Leone. This is a critical service in a poor country whose food security relies on local production as well as imported rice. Unfortunately, they live in a country with one of the most poorly funded healthcare systems on the planet, which means that 1 in 8 women die of childbirth, and that malaria kills 1 in 5 children before they reach the age of 5.
These problems within our health sector is as a result of the civil war that we went through from 1991 to 2001, and then also the issue of our medical doctors and nurses migrating from Sierra Leone to other countries actually gave lots of problems with all of these things. But then also, when you look at the areas of our operation in Kori chiefdom, the roads are really terrible. Those are very small villages, and people find it difficult to travel from those villages to seek medical attention in the bigger towns.
Clearly, to avoid needless fatalities, preventative health care must reach the remote villages where these vulnerable people live. The YMCA of Stift Quernheim is addressing this need through its Driving Doctor program. The program began serving the most remote villages in Kori chiefdom in 2008, providing medical assistance to over 100 pregnant women and 200 vulnerable children. Some villages can be reached with a 4-wheel drive vehicle, but to reach others, the medical team must travel for long distances on foot, through forests, rivers, and open grassland.
Morning. Yeah. We are going to 11.
Upon arrival, the medical health officer organizes the medicine and vitamins and begins reviewing medical reports, while a community health officer hosts an assembly to discuss sanitation and nutrition. The team also listens carefully to the questions and concerns of the residents. Because this YMCA project is rooted in Christian belief, the team invites the gathered assembly to join them in prayer before commencing the medical treatment. With all the supplies unpacked and laid out on a table, the nurses begin to give any necessary injections to the babies, examine pregnant women, and prescribe medication. The long lines highlight the demand for this basic medical attention in Kori chiefdom, and also the unmet demand for healthcare in hundreds of other remote villages throughout Sierra Leone. If this demand is not responded to, the rates of maternal and infant mortality will remain high. But the results achieved by the Driving Doctor program have been thoroughly encouraging. From March to September 2009, not a single woman died in the villages served by the program, and all 34 babies born during that time were healthy.
She said thank you. You've done a lot for them. So taking care of our children is a very big thing in our life. Thank you.
The men and women of the villages served by the team express their gratitude with gifts as well as kind words, but they also express their deep concern that the project will continue, so that in the future their children will be healthy and that the birth of a baby will not cause the death of the mother. They know very well that healthcare comes with a cost. Your donation of any size will ensure that we can sustain our current operation and expand to meet the demand in other remote villages.